Hello, emergency department physicians. The control period of the Syncope study is now complete. Thank you so much for your support. We are now in the intervention period where we will be using the Canadian Syncope Risk Score, which was developed by your very own Ottawa-led Canadian team. During the intervention period, we recommend using the Canadian Syncope Risk Score-based practice recommendations as much as possible. Please refer to the Canadian Syncope Pathway poster displayed in your emergency department. Complete the online form through the research link in Epic. This study will assess health resource utilization before and after the implementation of the Canadian Syncope Risk Score-based practice recommendations. As this is part of clinical care, no patient consent is required. The Canadian Syncope Risk Score practice recommendations should only be applied on patients over the age of 18 presenting to the emergency department within 24 hours of true syncope. Remember that true syncope is a transient loss of consciousness followed by a spontaneous complete recovery. The Canadian Syncope Risk Score should not be applied if the patient did not suffer true syncope or meets any of the exclusion criteria listed below. Furthermore, the recommendations should not be used if a serious underlying condition is identified during the emergency department evaluation or if the patient is hospitalized for a reason unrelated to syncope workup, for example, unable to cope at home or for pain control. Here's a quick tip. Troponin testing can be skipped if all of the following 5 ultra-low risk criteria are fulfilled. Age less than 50 years. No history of heart disease. Normal triage systolic blood pressure between 90 and 180. Normal electrocardiogram. And lastly, if the clinical impression is non-cardiac syncope. Now, let us look at the Canadian Syncope Risk Score itself. There are 8 predictors in 4 categories. Clinical evaluation, electrocardiogram, lab results, and presumed emergency department diagnosis. Clinical evaluation. Did your patient have a predisposition to vasovagal symptoms, history of heart disease, or abnormal systolic blood pressure during the emergency department stay? Electrocardiogram. Does your patient have any of the following electrocardiogram abnormalities? Lab values. If a troponin was drawn, was it elevated? A positive troponin value is above the 99th percentile or 14 nanograms per liter at the Ottawa Hospital. If a troponin was not measured either because the patient fulfills the ultra-low risk criteria or you chose not to measure it, select Not Done. Diagnosis in the emergency department. Lastly, what is your diagnosis at the end of the emergency department visit? Vasovagal syncope, cardiac syncope, or other. Please select only one of the 3 options. Canadian Syncope Risk Score ranges from -3 to 11. Patients are stratified into low, medium, or high risk categories. The CSRS provides recommendations about outpatient monitoring and hospitalization. If the patient is discharged with cardiac monitoring, please ensure that the patient's information is accurate to allow for timely contact in case of serious arrhythmias. Once submitted, the patient information is immediately forwarded to the central monitoring station. A locker number and password to access the cardiac monitor will be displayed. Please retrieve the cardiac monitor from the designated area within the emergency department. Please give the package to the patient. All necessary information is inside, including device hookup instructions and contact information for the research team and the monitoring center's 24/7 hotline. We would like to conduct a 30-day follow-up and use leftover blood for cardiac biomarker testing. For this part, we request that you obtain verbal consent from the patient. If the patient refuses, please indicate so in the form. Here are a few tips from the research team. Complete the form accurately at the end of the emergency department visit. No consent is required except for the 30-day follow-up and testing of leftover blood. Please remind patients discharged with cardiac monitoring that they will receive a phone call the next business day. Resources for physicians. Patient infographics are provided at the end of the web form. They can be printed and used for discussion and as a handout. Thank you so much for watching and contributing to Syncope Research.